Good afternoon, and welcome to our featured quality lecture for Nursing Research and Quality Week. My name is Tina Humboldt. I'm from the Department of Nursing Research and Quality Outcomes here at Children's National. It is my great pleasure to introduce to you Dr. Brenda Sheingold, who's our featured quality speaker today. Dr. Sheingold received her PhD in Public Policy and Nursing from George Mason University, along with a master's degree from the Johns Hopkins University School of Business, where she also completed a graduate certificate in change management. Dr. Sheingold has led a successful professional career, having previously served in the office of the Assistant Secretary for Planning and Evaluation here in Washington, D.C., along with being the Senior Quality Project Manager for the Kaiser Permanente Mid-Atlantic region. Additional professional achievements include the George Washington Chapter for Sigma Theta Tau Research Award in the years 2013 and 2014 for her work on identifying best practices in nurse-led, patient-centered medical homes, and the George Washington Honor Society Excellence in Research Award in 2009 for her work on measuring social capital in the nursing workforce. In 2012, she was inducted as a Fellow and Distinguished Scholar in the National Academies of Practice. Her extensive list of accomplishments includes various research grant participations that list nursing to be frontline representatives in the quality landscape, in addition to her authorship of more than 30 peer-reviewed publications, both nationally and internationally. Dr. Sheingold is founding faculty for GW School of Nursing, where she has supervised over 40 successful DNP research projects and serves as a Director for Healthcare Quality Graduate Programs. But on a more personal note, she has been an integral member of my personal journey for my academic growth and development while pursuing my DNP degree in healthcare quality. And I'm pleased to honor Dr. Brenda Sheingold.
Thank you, Tina. Can everybody hear me with this? Maybe I didn't press it.
Both mics are on.
Okay. So everybody can hear okay? All right. I want to thank Tina for that introduction. It kind of made me a little tired. I didn't realize how busy I had been before that. So the title of the presentation, Aspire, Learn, Think, Adapt, and Thrive. You're going to hear those concepts threaded throughout the entire presentation. And most of what you're going to hear is going to focus on personal development and in terms of how to become a good interprofessional team player, team member in research. Most of us, and when I look around the room, I can say that, most of us have not been educated in that vein. We've been educated in silos in medicine, in nursing, in physical therapy, as TAs, and it's really only been recently that we're expected to do research together, we're expected to perform and learn together, and if you're in school now, you're lucky because that's what you're getting. But if you're finished and you've graduated any time prior to the last 2 years, you probably haven't had much of that, if any of that. So that's what I'm going to focus on, is sort of how do we do what we're now charged with in this new era. So the first sea change that happened in terms of quality and the need to move forward with interprofessional teamwork is the CMS Innovation Center that was established because of the Affordable Care Act in 2010. It helped us understand results in new care models that were being innovated and are best developed and understood by a variety of disciplines. And it started really launching a big push for health services research as opposed to medical research, nursing research. It's all sort of being combined now under this health services research umbrella. The second thing that happened to change the landscape was the Impact Act in 2014, which was comprised of multiple disciplines to provide information and input into that act, and it provides money for evaluation of health services research, especially for populations with social risk, and that was an add-on to it that has actually gotten a lot of attention and a lot of focus. And then the final sea change, I think, is what you're seeing here today. The title of this, this conference is the Annual Nursing Research and Quality Outcomes Day, and I haven't talked to the organizers about this, but you may be the last attendees to ever come to this. because I suspect that it's down the road, this name is going to change, and it's going to be more inclusive and more interprofessional, and this name may no longer be used in 2017. So that remains to be seen, and that's anecdotal on my part. It might not happen, but certainly that's the trend. So there's a lot of change occurring in the delivery system. It's evaluation-based. There's a lot of innovation. There's a greater link between health services research and policy, and just a greater demand for interprofessional care delivery informed by research. So the purpose of this presentation is how can we build and sustain interprofessional teams for health services research to improve quality. So here's my objective. It's to explore the science of mental agility and creativity. It's to consider the concept of connectional intelligence for problem solving, which you're starting to hear a lot of now. There used to be a lot of talk about social intelligence, emotional intelligence, and now the new way of thinking in this, in this new world is connectional intelligence. So I'll talk a little bit about that and examine the patterns of transformation and change in healthcare and how you can incorporate them in your own research agenda. So I did want to mention Lindsey Stirling. She was the musician that was playing the music when you came in. I did that on purpose. There are a lot of attributes about Lindsey Stirling other than her music. She was on America's Got Talent, and that's how she came onto the music scene, was through America's Got Talent. And I'll talk more about her later, but one of her recent accomplishments has been to publish this book. It came out in January, The Only Pirate at the Party. The name is attractive on a couple of different levels. She speaks to this in her personal life, but I think a lot of what we've done in the past, we've been the only pirate at the party. That's us. And we've been siloed. That's the way the culture was in healthcare delivery. And if we stay as the only pirate at the party, we're not going to succeed. We have to change, and we have to learn how to be different and cross over, because the worst thing you can do is not be able to change and not be able to cross over. So research in general, I think, needs to have more curb appeal. You need to have different curb appeal as a professional and research, and you need it in order to be understood. And if you want your ideas to have value and provide meaning, you have to learn to be a good interprofessional researcher in working with others. So usually when we talk curb appeal, it looks like this. And I just used these words with a student a couple weeks ago. She turned in this poster for her project, which was an outstanding project, and I said, this is great. And she knows I'm using her poster today. I said, this is really nice, but it has no curb appeal. When you do a poster presentation and research, you're competitive with a lot of people in the room. You want to have them, come to your poster to view. And I said, I'm not so sure that that's going to be attractive to people. You have to think of curb appeal. So this is the next same exact results, same exact project, same exact students, but a lot more attractive in terms of drawing people in so she can tell her story and give her elevator speech about a really awesome project. So that's what I mean by curb appeal, personal curb appeal, so that you can be included in this future of interprofessional research. So I want to make sure that, like I said, I'm one of those people that was not educated in an interprofessional sense. I graduated from 3 different nursing schools before I ever went to grad school, and there was never any kind of crossover. So how are we going to get this now, all of us that are out there working in healthcare, finishing with terminal degrees? That opportunity has passed, and I think we just have to look to the world around us to try to learn this different skill set. So one of the things I did was to take a look at this framework of aspire, learn, think, adapt, and thrive. So I think this is a really good science-based approach, innovating minds, for rethinking creativity to inspire change. This book just came out last year. I think a lot of people are struggling with this concept of how to be creative in this time, and the book is actually, 2 days ago, was sold out on Amazon. So a lot of the scientific framework I'll talk about came from this. There's really quite a bit out there and not enough time to talk about all of it, so I'm just going to hit the highlights. So they have 5 questions that they suggest you ask yourself in order to build a science-based thinking framework. So question 1, what ideas are competing for your attention and awareness, and how are you helping form and reform them? So this talks about, I think, how to increase your personal curb appeal. And you don't have to answer these questions, I'm just putting them out there for you. The next one, should you be zooming in to a bigger picture or a more detailed abstract perception or a specific view? And this really speaks to being mindful of what perhaps your Myers-Briggs type is, the fact that you need to involve and respect people that are different from yourself in order to really bring whole brain thinking to a project. And then, are you allowing sufficient room for spontaneity and deliberateness in your creative process? Do you know when to trust your routines? And the emphasis here is on routines. So it's tough in Washington to really calm down your mind enough to think about your routines, and are they allowing room for spontaneity and deliberateness in your creative process? I mean, it took me almost as long to find a parking space as it did to drive here. So I really can see it's just a stressful town. That's the way it is, and we learn to live with that. But when it comes to creativity, that can crowd it out. That kind of lifestyle can really crowd out creativity. So the emphasis is to find this calmness in your normal routines. And I asked my husband about this because we both do creative work in a different way, and we both have completely different personalities. And I said, so how do you calm your mind to be able to think creatively? What do you do? Because I never really see him do anything like that. That comes to my mind. And I know he runs, he works out all the time. He's at the gym today, working and on the treadmill. So I said, I know you do that, but what else do you do to really calm your mind? And he said, I load the dishwasher. And I said, oh, you don't load, because usually if I do that, he'll go back and redo it. And so, I've learned not to even really try much anymore. So, but I didn't realize that was one of sort of this Zen thinking. He's a big Phil Jackson fan, and Phil Jackson has written a lot about calming your mind and doing routine things. And then it made me think of, well, ironing kind of makes me feel that way too, which I don't get to do very much of, but when I do, it sort of has this Zen feeling. So you need to be conscious, especially around here, of things that you might be doing every day that calm you, and sort of be present in that moment. So I think that's what this question is, and it's different for every person. Not everybody's going to have the same answer. And then, are you receptive to the interplay of motivation, emotions, and perception with your thinking? And this goes back to the question of balance. And again, the answer is different for every person, but you do have to think about that for yourself. And then the last one, are your physical, symbolic, and social thinking spaces, including your workspace, spurring or spurning creative thought? And so, that's a hard question too. A lot of us have different workspace now than we did 10 years ago, but you really need to put some consideration into that in terms of creative thinking and being able to move that forward for yourself. And, for me, and going back to my personal example with my husband, that might be our phone call. going back to my personal example, we share an office at home, and I was a little worried about the juxtaposition of the desks. You know, I was a little worried because I was prepared to stick up for myself. This phone call is actually related to this conference, and I'll explain that at the very end. So Tina's going to go take care of that. But anyway, so I said, well, what about the desks? There's only one window in the office we have at home, and he didn't care less about the window. You know, I was very happy about that. He's looking at a wall, you know, in the corner. That's the way we had like custom desks made because we work at home so much, and he was happy with that, and I was very happy because I have the window, and that was important to me. So we both work in completely different ways, but we're aware of our preferences. So that's one of the ways you can help yourself, is to be aware of your preference and honor that in terms of your workspace. So ideas can be deliberate or intentional or spontaneous, and we'll talk about both. And what I'm referring to are ideas for research projects, ideas to improve the quality of patient care and improve healthcare delivery. So this comes from, we're going to talk about Learn next, and I'm going to talk a little bit about this book, Get Big Things Done, The Power of Connectional Intelligence. And when I looked up when I read the book, the definition of connectional intelligence is this. I'm just going to read it. I don't really like to read slides, but I'll read this. The ability to combine the world's diversity of people, networks, disciplines, and resources, forging connections that create value, meaning, and breakthrough results. So when I heard that, I thought, oh my God, that's exactly the same definition for interprofessional research. There's really no difference there between the two. It's really identical. And this is exactly what the Affordable Care Act and the Impact Act have hoped to achieve, is this kind of outcome. So connectional intelligence comes alive when you connect to individuals that share your vision and say, we're ready, we're all in. So that's the kind of team you have to find. And this is what happens when you have good personal curb appeal. You'll find these people that say, we're ready, we're all in. So this is I just added this over the weekend, to be each other's passion finder. I love that phrase, and it actually came up on the news on Channel 4 over the weekend because they had the Science Expo here in Washington, D.C., and they were explaining it, on the news, explaining it to the public, and they said to parents, you have to bring your children here. This is their passion finder. So I thought that really translates to us, too, that we have to be there championing each other, be each other's passion finder. So Learn, and I wanted to talk a little bit about, this is from Georgetown Cupcake's website, and I was very struck, and this goes back to spontaneous ideas and just being mindful of the world around you to get ideas for research. So Georgetown Cupcake, when you go onto their website, they have something new. They have live webcams posted in their bakery. They have them in the, let's see if I can, not sure what happened here. Let me try this computer. That's all right. If you want to try to fix it, I can tell this without the cupcake slide. I know the story. So they have webcams like on their racks where they're cooling. They have them on the icing table, and also packing boxes, so that you can log on to their bakery anytime and see these live webcams. And I thought that's fabulous, because as I'm watching it, there's just no way that it doesn't make you hungry for a cupcake. It's like very effective marketing. So I called them. I called them up and I said, I really love your idea. The webcams are great, but where did that idea come from? That's what I really wanted to find out. Well, what do you think the answer was? I mean, this really is kind of a trick question around here.
People want to know the process.
Well, they did, but it came from the Panda House. It came from the live cams in the Panda House because the public interest is so, it just sucks you in when you turn those cameras on. And they were also featured on a show called DC Cupcake, and it was TLC and the Discovery Channel, and the creative services team from those stations said, we really think this might work. We see how it's working in the Panda House, we see how it's working elsewhere, and it increased their business exponentially and also created this international market that they can't address. They don't have the ability to deliver cupcakes internationally, but they do have this fan base as a result of these cameras. So it's just one example of when you talk about thinking outside of the box, people say that a lot, but then you don't really know what that means. This is really outside of the cupcake box. But just a really creative example of somebody had their thinking cap on and came up with this fabulous idea, and it works. So I tried to put a picture of the pandas up there. So, and as I was interviewing, because I did interview Allison, the assistant manager, she made this statement, which was, I thought, very powerful. She was talking about the attributes of a cupcake and how people can't resist them. And the last thing she said was, it doesn't crumble. And I said, oh, Allison, that's so powerful. That statement can apply to